Hi, my name is Ali, and I'm the co owner and certified athletic therapist at Revival. Today, we'll be discussing the most commonly asked questions about PEMF therapy. PEMF stands for Pulse Electromagnetic Field Therapy. At Revival, we like to describe it as a way to exercise your cells. Every cell in your body has its own natural electrical charge. When you're injured, stressed, encountering sickness, or inflamed, that charge weakens. PEMF uses gentle, low frequency electromagnetic pulses to help restore that energy, recharge your cells, and improve circulation, oxygenation, and cellular communication. It's completely non invasive and drug free. Think of it like recharging the batteries that keep your body functioning optimally. Whether you're recovering from an injury, struggling with chronic pain and loss of performance, or just feeling run down, PEMF helps your body work the way it was designed to expedite your recovery. This innovative technology has been extensively researched and proven to be highly effective in reducing pain, promoting tissue regeneration, and enhancing overall well-being. So, how does PEMF therapy work? PEMF therapy works by sending magnetic pulses through your body that safely penetrate deep into muscles, bones, tissues down to your cellular level. These pulses stimulate electrical and chemical processes inside your cells, enhancing ATP production, nutrient exchange, and detoxification. The result? Improved circulation, reduced inflammation, faster tissue repair, and better nerve and muscle function. In other words, PEMF helps the body do what it already knows how to do, but faster and more efficiently. At Revival, we use a high-powered, clinical-grade PEMF system that is Health Canada approved, designed to target both acute and chronic conditions, helping you recover from injuries, calm chronic pain, and even improve your sleep and energy levels by restoring healthy cellular communication. PEMF therapy has shown benefits across a wide range of conditions because it targets the root of dysfunction, your cellular health. It's been studied extensively for bone healing, arthritis, postoperative recovery, inflammation, and other neurological conditions. At Revival, our clients use PEMF for chronic back pain, tendonitis, nerve pain, plantar fasciitis, osteoarthritis, cancer recovery, ALS, Parkinson's, digestive issues, and other chronic conditions. It also supports faster recovery for healthy athletes and people managing chronic fatigue or circulation issues. Because PEMF therapy boosts oxygen delivery and nutrient exchange at the cellular level, it is ideal for anyone wanting to reduce pain, accelerate healing, and improve overall vitality. It doesn't replace other treatments, it enhances them, complementing hands-on therapy, exercise rehab, and movement retraining. Yes, PEMF therapy is extremely safe when performed by trained professionals. It is non-invasive, pain-free, and has been used for decades in hospitals and rehabilitation centers. In fact, certain PEMF devices are FDA and Health Canada approved for bone growth and post-operative pain management. The electromagnetic frequencies used are completely different from the high-frequency, potentially harmful EMF radiation that you get from Wi-Fi or cell phones. PEMF uses low-frequency pulse electromagnetic fields that mimic the natural electromagnetic rhythms of the Earth, frequencies that your body actually needs to stay in balance. At our clinic, every session is delivered by our highly trained certified therapist, tailored to your comfort and screened for any contraindications like implants, pacemaker, or pregnancy, ensuring a completely safe treatment experience. Most clients describe PEMF as a warm, rhythmic pulsing sensation that's deeply relaxing. Depending on the area being treated and the intensity of the treatment, you might feel gentle tapping or light muscle contractions as the electromagnetic field activates the tissue. Many people say it feels like their body is waking up from the inside out, sometimes even noticing immediate relief or sense of lightness and a burst of energy afterwards. You can even choose to close your eyes, listen to calming music, or meditate during your session. By the end, most clients feeling recharged, relaxed, and often surprised at how good their body feels compared to when they came in. A typical PEMF session at our clinic lasts between 30 to 60 minutes, depending on the selected protocol, area being treated, your tolerance to magnetic frequency, and your recovery goals. Full body recovery or chronic conditions benefit from longer and more frequent exposure, up to about 3 sessions per week. During your first visit, our therapist will complete a thorough assessment to determine the optimal protocol, duration, and intensity for you, tailored to your needs. Some people choose to do standalone PEMF sessions, while others integrate them into a treatment plan that includes manual therapy, exercise, or even combine it with our BioFlex laser therapy. That way, we ensure that the effectiveness of your treatment is maximized. Your time under PEMF is calm, restorative, creating an optimal environment for your body's natural repair systems. Results vary depending on your condition, but many clients notice a difference after the very first session, especially with muscle tension, soreness, or fatigue, and that typically lasts anywhere between 4 hours to 4 days. For chronic pain, arthritis, or neuropathies, changes typically build gradually over several sessions as your body restores balance at the cellular level. Think of it like charging a battery that's been drained for years. It takes a few sessions to fully restore energy flow and function. Over time, you may notice less pain, more mobility, deeper sleep, and better overall recovery. With PEMF therapy, consistency is key, and that's why we often recommend a short treatment sessions and series to maximize results. The number of sessions depending on your goals and conditions being treated. For acute injuries or post-workout recovery, even 1 to 3 sessions can make a noticeable difference. For chronic pain, joint degeneration, or nervous system imbalances, we often suggest a series of 6 to 12 sessions, spaced 1 to 3 times per week. The effects are cumulative. Each session builds on the last, recharging your cells to operate more efficiently over time. Once you reach your target results, maintenance sessions every few weeks can help sustain long-term benefits. Your therapist at Revival will personalize your plan to match your body's response and lifestyle. Some clients feel immediate relief, like improved range of motion, reduced stiffness, less pain, and energy boost after their first session. Others notice more gradual improvements over the following days as they go through detoxification, then inflammation will start to decrease and circulation improves. For chronic and complex issues, consistent sessions over several weeks yield the best results following the treatment protocol. It is important to remember that PEMF doesn't mask symptoms. It repairs function at the source by restoring your body's cellular communication. That's why results can feel more natural and longer lasting. At Revival, we often combine PEMF with movement, exercise, and manual therapy to amplify those long-term improvements. PEMF therapy is considered low risk and well tolerated by most people. Occasionally, clients may experience mild fatigue, temporary soreness, or increased detoxification responses, which are the signs that your body is adjusting to improve circulation and energy flow. These effects are usually short-lived and resolved quickly. However, PEMF should not be used by individuals with pacemaker, implants, or any other implanted electrical devices, as the magnetic field could interfere with their function. We also avoid PEMF during pregnancy or in cases of active bleeding or active acute infection. Before every session, your Revival therapist will perform a full screening to make sure PEMF treatment is safe and customized for you.